mentioned Ghana. Can I just ask you about your social franchising model? Because that's really interesting.
Yeah, well, much later on, and this is sort of now coming right up to date, what I've realized that with the best will in the world, funding for this kind of work is difficult. This is an area which is tremendously underfunded by the state, but it's also tremendously underfunded by philanthropy. It's a real gap in the philanthropy market, and so those people who have recognized this financially, I'm eternally grateful to, but I would like a heap more to recognize this. What I figured was that it was really important to be able to actually work locally in Ghana and to be able to draw the resources out of the Ghanaian state as much as possible. So what we now do is we draw resources out of the Ghanaian state. They provide nurses and all the rest of it. We've said that. But when it comes to the social franchise, we are also able to engage large organizations. These are not small outfits, but quite large organizations, created and founded by Ghanaian citizens who have sort of started to think, well, goodness, this is a big problem after all. And so can we take your model, they say to us, can we take your model and can we work with it? And we have started a process whereby we train them. We have a computer portal where we can reach them. Because the great thing with franchising is you've got to make sure that your quality remains up. As soon as you give your model to somebody else, you have to know that the quality of the model is being maintained. And that, of course, is one of the great challenges which we are now working through and developing further.
Great. And Pamela, what about interventions on the individual level?
Yeah, so individuals live in communities, and the key to actually getting care, I think some of the innovations are around the way that we deliver it. So I gave one example in Los Angeles, but what we're seeing and what some of the things that we're investing in low and middle income countries have to do with using non-traditional providers. So when you have a country, as Chris talked about, where there are 2 psychiatrists for the entire country, who's the person that's going to deliver these services? And I'm talking about evidence-based interventions, the things that we know work and are effective in reducing symptoms of depression, anxiety, et cetera. And so what's really exciting is that there's an increasing amount of data showing that you can train community health workers, you can train people with a high school level of education, provided that they have good supervision, ongoing quality assurance through that supervision. We're also doing some work now with peers. So the example of maternal depression, postpartum depression. We're supporting work in Pakistan and India that is actually getting moms trained to be the people that are actually delivering the intervention to other moms. And a lot of these women say, when I went through this experience, there was no one to recognize this illness, there was no one to talk about, and they feel really great being able to make this kind of a contribution. So I think this is actually it's a low-tech but incredibly important intervention, and knowing that we can actually vary the kind of providers that are used to deliver evidence-based interventions. And this is useful in a lot of low-resource contexts.
You know the evidence for using community health workers or training lay people to deal with mental health? Where does that evidence come from? Is it from the US or is it other parts of the world?
So actually, I think this is one area where most of this innovation is happening in the field of mental health specifically. It's happening more in other parts of the world. So we've got some, again, rigorous trials from Chile, from Pakistan, from India, from Uganda, and others that are in process in Ethiopia, South Africa, Nigeria, Ghana, showing and trying to establish how do we do this? How do we, in settings where you don't have the specialists that you need, how do you use the resources that are available in a way that provides good quality care? Because that's important, obviously, to make sure that what people are getting is quality care.